The latest offering from InterSystems is the HealthShare CMS Solution Pack, a turnkey solution that helps payers and providers meet the CMS Interoperability and Patient Access Final Rule, or CMS Rule 9115F. This video explains Rule CMS 9115F and demonstrates features of the HealthShare CMS Solution Pack, including API management and data transformations. The CMS rule from the Centers for Medicare and Medicaid Services includes several new requirements. First, members of health plans covered under this rule must be able to use a third-party application to view their own medical histories, including clinical and claims data, and to determine which drugs are covered by their health plans. The rule also makes it possible for anyone to search a health plan's provider directory. In broader terms, the CMS rule encourages development of next-generation healthcare applications that bring valuable data to patients and potentially providers. CMS has also defined a set of data sharing requirements for both payer and provider organizations that will need to be implemented between 2021 and 2023. Two APIs are required as of January 2021, with enforcement starting in July of 2021. The Patient Access API and Provider Directory API. Both APIs use the HL7 FHIR R4 standard. The first required API, the Patient Access API, is the mechanism by which members of payer organizations can request that their clinical, formulary, and claims data be sent to specified third-party applications. The Patient Access API exposes data contained in all three of the following: United States Core Data for Interoperability, or USCDI, Common Payer Consumer Dataset, or CPCDS, and the DaVinci Specified Pharmacy Benefit Data. The second API, the Provider Directory API, gives the public a way to access and view provider details and to locate pharmacies in the payer's network. The Provider Directory API relies on an implementation guide published by the HL7 DaVinci project. Next, let's look a little more closely at some of the components of the HealthShare CMS Solution Pack. In the developer portal, shown here, you can develop, test, and manage APIs. App developers can access your APIs while you monitor and manage their usage. Implementing new APIs can be a challenge, especially with systems that have never supported on-demand API-based data exchange at a large scale. The CMS Solution Pack includes the required APIs and data transformations, and offers tools like custom FHIR profile support. One method for adding support for a new FHIR profile to a HealthShare FHIR server involves getting a JSON package with the profile definition and adding it to a new or existing FHIR endpoint. Tools such as these prepare users to easily adapt to future rules and innovations in data standards. Finally, let's look at how the critical piece of data integration and transformation can be done in the HealthShare CMS Solution Pack. An interoperability production converts between two documents in X12 format, a well-established standard for claims and payment data. Similar interfaces perform the transformation between X12, FHIR, and other data standards. InterSystems has been supporting healthcare interoperability for decades and is a member of leading standards organizations, including HL7's DaVinci project and the Karen Alliance, so expertise and field experience are baked into InterSystems products. It can be challenging to improve a data foundation, which is why the CMS Solution Pack includes implementation services to help payers and providers transition to using HealthShare. The CMS Solution Pack supports payers and providers in meeting imminent deadlines and preparing for future innovations.